HRT, again, making headlines this morning. Dr Hilary and Dr Amir are with us. This is all about, well, treatment really for the menopause, isn't it? What doctors should be doing.
Yeah. So this all stems from the National Institute for Health and Care Excellence, NICE. They issued draft guidance last November suggesting that cognitive behavioural therapy or talking therapies should be perhaps suggested first for women with menopausal symptoms. They've now had a rethink. They've rewritten their guidance and saying that, no, HRT should be the first choice for women with moderate to severe symptoms. Of course, some women won't need any treatment at all. If they've got very mild symptoms, they can be treated in other ways. But cognitive behavioural therapy as well as HRT for some people, for those people who can't take HRT or don't want to take it. Bearing in mind that you should always discuss it with your GP anyway, looking at the risks, the benefits. But HR is still very good, provided it's prescribed in the right dosage and in the right manner.
You've just got to be really careful.
Absolutely.
You do. I mean, it's an amazing thing, but you've got to get it absolutely right. And in the past, too many doctors have just prescribed, antidepressants when they maybe shouldn't have done.
That's right. That's right. Sometimes too high
dose. OK, we are today. Dr Amir, we're talking wee-wees. Aren't we?
We are talking wee-wee. I do have a pot of pee from a patient from before I was going to use as a prop, but I'll leave it out. We're talking about the colour of our wee and what it can tell us about our health. Now, it's normal for wee to change colour from day to day, but it should stay within a relatively narrow range of yellow. So we have got a colour chart here to show everyone. So if your urine is clear, so water-coloured, you might actually be drinking too much water or fluids. Now, that might not sound like a bad thing, but sometimes too much fluid can dilute the salts in your blood. And so we don't want that to happen. We want it to be this nice pale yellow straw colour. That's well hydrated, lovely concentration of electrolytes there, perfect. If it starts to get dark yellow, then you could be dehydrated. Brown urine could again be dehydration, but it could be old blood in your urine that needs investigating, or it could be bile in your urine from liver disease as well. That needs investigating. Red or pink urine, this is important. That could be a sign of blood in your urine. Now, if it's painful when it's coming out, pink or red, it could be an infection or a stone. If it's painless, this is the really important message. Painless blood or pink or red urine, you must get seen. Even if it happened a week ago and it's cleared up since, that could be a sign of cancer in your bladder, in your kidneys. Get that checked. Blue or green urine is very rare, nothing to worry about, usually something that you've eaten with some dye in it. But that pale yellow is the kind of the gold standard, so to say, of urine. That's what we want.
Fantastic. Thank you, Amir. And Hilary, obviously it's used a lot because, I don't think there's one of us that's not going to the doctors and they've said, bring a sample. Yeah. Especially if you're a woman, especially that happens with a lot. So there's a lot you can tell.
No, absolutely. We actually need a Dulux colour chart of urine colours, don't we? It'd just be very helpful.
Yes.
I mean, it's just like looking at your poo, tells you a lot about what's going on in your tummy.
Sure.
And we have the Change and Check campaign for breast cancer. So this is similar.
Right.
If your urine is cloudy, that could suggest a urine tract infection, particularly for women who are much more prone to it. So cloudy urine is a sign. And also, if you've got frequency, if you're going more often, if you've got some burning or stinging sensation, backache or discomfort above your pubic bone around your bladder area, then clearly that could be a urinary tract infection, which you should discuss with your pharmacist or your GP.
Right, exactly, because that's the thing about UTIs, isn't it, Amir? You've got to get them seen quickly because they can be so debilitating.
They really can. So urinary tract infections, it's an infection anywhere along the urinary tract. So it could be in the urethra, that's the tube that connects the bladder to the outside world and takes the urine out. It could be the bladder, it could be all the way up to the kidneys. And what we want to prevent is the infection tracking up towards the kidneys. That's where it can cause a serious infection, possibly sepsis as well. Women are more prone, as Dr Hilary said there, to urinary tract infections because the most common bug that causes a urinary tract infection is E. coli, which is found in your poo, your gut. And it can climb in through the urethra, that tube that carries the urine out. And because women have shorter urethras than men, it doesn't take much time for them to climb up towards the bladder and cause that infection. So it's really important. I know women know this already, but it's really important when you go to the loo to wipe from front to back, not back to front, because that can introduce E. coli into your urethra. And also, peeing after sex is really good as well because it can flush out any bacteria that could have been introduced after sex too. So, and also, what I will say, don't use any feminine kind of washing products to clean the vaginal and urethral area. You don't need it. The vagina is self-cleaning. Cranberry juice, that's something that people often ask. Can cranberry juice prevent urinary tract infections? No, the answer is no, but hydrating with cranberry juice can help flush them out. That's not a bad thing. There is a little bit of evidence that cranberry extract tablets can reduce the number of UTIs. But I would say, as you just said there, Lorraine, if you think you've got a urinary tract infection, go and see a healthcare professional.
No, exactly. All human life is here, Amir. We talk about everything, don't we? We've talked about
no taboos
in that one sentence.
Are there any taboos left?
There was a lot. But the thing is, an awful lot of women as well keep getting infections, don't they? Repeatedly.
Very cool. Recurrent urinary tract infection is a real risk for women, so they're getting it all the time. Now, if that's the case, then they should talk to their GP. Certainly get a sample tested and cultured to see which bugs, if any, are the cause of it. Now, if you've got bugs there which are resistant to the antibiotics you've been taking each time, then it might be worth taking a low dose of antibiotics for several months as a preventative precaution.
Okay.
And sometimes you need to investigate the kidney and the tubes just to make sure there's no valves or abnormalities which could be responsible. So it should be treatable, and certainly what we don't want are recurrent infections to get worse, infect the kidneys themselves, because that can lead to sepsis and more serious
I mean, it can tell you so much, Amir. I mean, you've talked about the colour of it, but what else can it tell you as a GP?
Yeah, the smell of it can tell you something as well. So often people think, oh, my urine is smelling strong, I could have an infection. Usually strong-smelling urine means you haven't drunk enough and you just need to drink more. But if it smells of ammonia, that could be a urinary tract infection because bacteria give off waste that smells of ammonia. It could be a sign of a kidney stone, but the menopause also changes the smell of your urine to smell a bit like ammonia. If it smells fruity, that could be sugar in your urine, and that could be a sign of type 2 or type 1 diabetes, and it's your body's way of flushing out that sugar, so that often needs checking. Certain foods can make your urine smell. Asparagus is famous for it. That can certainly make your urine smell. But if you're worried at all about the smell or the colour of your urine, the best thing to do is send in a sample to your surgery. We'll dip it and get back to you that way.
See? Simple as that. Simple as that.
You know, in the old days, doctors used to put their finger in somebody's urine and taste it.
Oh, behave.
No, they did, because it was sweet. It had sugar in it. That's why it's called diabetes mellitus, mellitus meaning honey. So that's what doctors had to do.
That's a rubbish job.
We don't do that anymore.
No, you don't want to be doing that anymore.
But people do talk about drinking their own urine.
Now, I remember Sarah Miles, a very famous actress who starred in movies like Ryan's Daughter, and she went on, and there was a hoo-ha about the fact that she did that.
Well,
I mean, what do we think?
Naturopaths have suggested this. I mean, it's been done for centuries. The ancient Egyptians, Greeks, Romans, they all did this.
Yeah, they've all died out now, though. They've all died out.
There's a reason for that. And certain celebrities, if you say, have endorsed it. But actually, there's no clinical evidence that it does any good at all. It's basically water and waste products. Why would you want to drink that? Give me a glass of Rioja any day.
I'm with you on that one. Or a glass of cranberry juice, perhaps.
Absolutely.
Thank you both very much. That was an eye-opener. I know many things. I love you two so much. Talk about anything, it's great.